Hypersensitive pneumonitis. Today I will discuss hypersensitive pneumonitis or immune-mediated lung disease caused by repeated inhalation of organic or inorganic antigens. So early recognition and management are key to preventive reversible lung damage or preventing the lung damage. So, what is a hypersensitive pneumonitis, also known as HP? It is a intrinsic allergic alveolitis, is a restrictive lung disease that results from an exaggerated immune response involving type 3 and type 4 hypersensitivity. It primarily affects the alveoli and the interstitium, lung interstitium, leading to inflammation, and in chronic cases it causes fibrosis. So what are the causes and risk factors? Hypersensitive pneumonitis occurs due to exposure to airborne antigens including blood protein in blood fancier lung, moldy hay grain that is called farmer's lung, contaminated humidifier or hot tubs also known as humidifier lung, wood, textile or plastic dust in occupational setting like textile mill, wood cutting factory. The risk factor, duration, intensity of exposure and genetic predisposition. Clinical form of hypersensitive pneumonitis. It can be first is acute hypersensitive pneumonitis which occurs in 4 to 8 hours post exposure. It has flu-like symptoms like dyspnea, cough, fever and chill. Second is a subacute hypersensitive pneumonitis which occurs weeks to months. It causes gradual worsening of cough, breathlessness, fatigue. And the third one is a chronic hypersensitive pneumonitis. Years of exposure, progressive dyspnea, fibrosis and respiratory failure. It can cause restrictive versus obstructive disease. Hypersensitive pneumonitis primarily a restrictive lung disease, though mild obstruction can be seen in some cases. So, what are the pulmonary function findings? Pulmonary function findings shows restrictive pattern in which total lung capacity decreases, forced vital capacity decreases, normal or increases. Forced vital capacity in 1 second and FVC, DLCO, occasionally obstructive feature in acute or subacute cases. Diagnosis, history and exposure assessment like occupation, hobbies, home environment. In HRCT chest, ground glass opacity is seen, centrilobular nodules, fibrosis. In bronchoalveolar lavage, which is known as BAL, lymphocytosis is more than 20%. Serology, IgE antibodies to be suspected to the suspected antigen. In lung biopsy, in chronic cases, non-caseating granuloma, interstitial fibrosis can also be seen. Now in management and treatment, In management, first is a antigen avoidance. It is the most effective in stopping disease and also the progression. Second is a steroid or corticosteroid. Prednisolone 0.5 mg per kg per day for symptomatic relief. And third is a immunosuppressive therapy like azathioprine, mycophenolate, MMH in chronic cases. Fourth is a oxygen therapy and pulmonary rehabilitation. For advanced cases, and the last is a lung transplant is considered in end stage fibrosis. So, as far as prognosis and conclusion, acute HP is reversible with antigen avoidance. Chronic HP can lead to irreversible fibrosis if untreated. Early diagnosis and exposure prevention are key to better outcome. Understanding hypersensitive pneumonitis is crucial for preventing misdiagnosis and long-term lung damage. Early, early intervention saves life. Thank you. Thank you so much.